Welcome to Crisis in Perception, where we examine the systems shaping our world one book at a time.
Today, we are undertaking a deep dive into a system that governs how we perceive, diagnose, and ultimately treat human suffering. We're talking about the psychiatric and mental health infrastructure.
Right, and it's a system that's designed to help, but so often it ends up perpetuating this profound stigma and, tragically fails so many of the people who need it the most.
The scale of that failure is, well, when you really look at the data, it's just mind-boggling.
It is. I mean, the sources we have, referencing World Health Organization data, confirm that mental health and substance use conditions are responsible for 25% of all health-related disability.
Let that number sink in for a second. 25%.
It's enormous.
That's 8 times more disability than is caused by heart disease, and an astonishing 40 times more than cancer.
So when a medical sector that's tasked with addressing a full quarter of all human disability is, demonstrably failing, leaving patients with worse outcomes or just in this state of chronic despair.
Then you have to look for the systemic flaws. You have to ask, what is wrong with the system itself?
Exactly. So the core question we're exploring today is a pretty radical one. How can a systems-level failure in medicine, specifically in mainstream psychiatry, be fundamentally reformed?
And we're asking if integrating objective biological data, modern neuroscience, can finally create a new evidence-based paradigm.
A paradigm that treats the physical organ, the brain, rather than just chasing symptoms with checklists and, generalized medications.
And to be really clear, this is a systems analysis. We are focused squarely on the established psychiatric industry, its reliance on subjective, symptom-based processes, and the incentives that keep that system stuck in place.
Right. We're contrasting that old system with a proposed new model that's centered on the biological reality of the brain. The focus is strictly on why these systems produce harmful outcomes.
We're not here to blame individual practitioners or patients. It's about the system they're all trapped in.
And the roadmap for this complete system overhaul comes from the book The End of Mental Illness: How Neuroscience is Transforming Psychiatry and Helping Prevent or Reverse Mood and Anxiety Disorders, ADHD, addictions, PTSD, psychosis, personality disorders, and more. And it's by Dr. Daniel G. Amen.
Dr. Amen is let's say, a highly polarizing figure within academic psychiatry.
That's putting it mildly.
Right. And it's precisely because he defies the institutional norms. He's double board certified, he's military trained, and his prominence is such that the Washington Post once called him the most popular psychiatrist in America.
But the real controversy, the thing that gets the establishment so riled up, is his pioneering and decades-long use of functional brain imaging.
Exactly, specifically SPECT scans in his routine clinical practice. And that is a practice that the mainstream has, for a very long time, dismissed.
And the sheer volume of data he's amassed by doing this it's just unprecedented in the field, isn't it?
Completely. His Amen clinics, which he founded back in 1989, maintain what is recognized as the world's largest database of these functional brain scans. We're talking over 170,000 scans from patients who have come from 121 countries.
Wow. And what makes that database so powerful is who these patients are.
Right. They specialize in treating complex psychiatric patients. These are people who have typically failed standard care. On average, a patient walking into an Amen clinic has already failed 3.3 previous providers and 5 different medications.
So they are, in effect, the system's failures.
They are the very definition of it. And this is the disruptive part. This is the statistic that challenges the entire status quo.
Go on.
84% of these complex, previously treatment-resistant patients report feeling significantly better after 6 months of comprehensive treatment.
Treatment that's guided by this brain-centric biological approach.
Yes. That level of success, especially in the face of such massive prior failure, really demands institutional attention. You can't just ignore that.
And his personal motivation for writing the book, it really speaks to this urgency for systemic change. He dedicated it to his nieces.
Alize and Amelie, yeah. They grew up in a really chaotic environment that was just plagued by high genetic vulnerability, multiple suicides, major depression, addiction, criminal behavior.
A generational cycle of severe, complex mental health issues.
Exactly. And the book is designed to be a blueprint to end that exact kind of cycle.
It also ties into this enduring shame and stigma in our culture, doesn't it? I mean, you think back to the political fallout for Thomas Eagleton in 1972.
Wow, absolutely. His vice presidential nomination was torpedoed simply because his history of mental health treatment was publicly revealed.
And that intense shame is still with us.
Yeah.
It prevents millions from seeking the care they need. And it just reinforces the inadequacy of a model that can't handle these widespread epidemics of suicide and addiction.
It highlights a system where the very language we use, the words themselves, get in the way of healing.
Okay, so let's unpack his central thesis, because it really requires a profound cognitive shift, both for clinicians and for patients. What is the fundamental immediate change Dr. Amen is demanding?
The thesis is very direct. The term mental illness must be discarded entirely,
Just thrown out.
thrown out, and it must be replaced with an objective medical term, brain health issues.
So the argument is that psychiatric problems aren't character flaws or moral deficits.
Not at all. They are medical, biological issues that originate in the physical functioning of the brain, period.
So the brain is just an organ? He can get sick, just like a liver or a heart can get sick.
Exactly. Which means the prescription for a field that's obsessed with all these complex psychological theories is actually deceptively simple.
Which is?
The core prescription, which comes from decades of data, is this. Get your brain right and your mind will follow.
Get your brain right and your mind will follow.
Which means fundamentally rejecting the subjective, symptom-based diagnosis from the DSM and moving instead to an objective, comprehensive approach.
One that incorporates neuroimaging, genetics, and these highly personalized lifestyle interventions to actually heal the physical organ.
That's the paradigm shift.
So, diving into the core ideas, the first and I think most damaging systems failure we have to analyze is the inadequacy of the current symptom cluster diagnostic paradigm. This is the foundation of the whole conventional system.
It is the foundation, and it is, frankly, correct. The status quo relies solely on the Diagnostic and Statistical Manual of Mental Disorders, the DSM.
Right, the DSM. And this system diagnoses patients based on checklists, right? You report your symptoms or someone observes them.
Precisely. If you check enough boxes for, say, major depressive disorder, you get that label. And then a quick prescription usually follows, often during a rushed 15-minute med check, probably in a primary care setting.
That might seem pragmatic, in a fast-paced medical system, but the book argues this method is just a catastrophic scientific failure. It's masking the real problem.
Well, there was a critical 2019 study published in Psychiatry Research that provided the objective data to back up Dr. Amen's critique.
What does it find?
The researchers found profound scientific shortcomings in the DSM model. There's major symptom overlap among different diagnoses, a systemic failure to account for foundational issues like trauma, and a complete lack of individual biological context.
And the mathematical implications of that overlap they're just stunning.
They're almost unbelievable. The study calculated that if you combine the symptoms for major depressive disorder with just 5 other common diagnoses, things like generalized anxiety, panic disorder, social phobia,
Okay.
you can arrive at over a quintillion possible symptom combinations that would all receive the same 6 labels.
A quintillion. What does that even mean?
It's a 1 with 18 zeros. To put that in perspective, a quintillion is over 1,000 times the number of stars in the entire Milky Way galaxy.
So the diagnosis, the label itself, is scientifically meaningless if there are that many ways to get to it.
The researchers basically concluded that staying committed to this disingenuous categorical system is scientifically invalid. And for the patient, the core problem is just deeply disrespectful.
How so?
Diagnosing based only on symptoms tells you absolutely nothing about the underlying biological cause. You could have crushing anxiety because of low blood flow to your brain, a hidden infection, exposure to toxins, or a past head injury.
But the DSM only notes the anxiety.
It only notes the symptom. It completely ignores the organ responsible for creating it.
If a patient walks into a cardiologist's office with chest pain, the doctor doesn't just hand them a pain reliever and call it crushing chest pain disorder.
Of course not.
They run tests. Right. They want to see if it's a clot or a muscle strain or maybe just acid reflux. So why is psychiatry the only medical field that treats the symptom without ever looking at the organ?
That analogy is absolutely central to the book's critique. The field operates on this assumption of underlying psychological mechanisms, but it never uses objective tools to actually examine the brain itself.
And Dr. Amen's point is it's kind of unassailable, isn't it?
Yeah.
Symptoms tell us nothing about the biology of the problem.
Nothing at all.
Which brings us naturally to the second core idea, the power of reframing this whole issue, making it medical, not moral.
The cultural baggage that's carried by the terminology mental illness, psychiatric disorders, it's immense. It just conjures these images of being mad or disturbed, unbalanced, or, somehow lacking in character. And that stigma is a major barrier to healing.
But if you reframe it as a brain health issue,
Yeah.
you immediately allow the person who's struggling and their families to see the problem as medical.
Right. No different than having the flu or a broken arm or diabetes. It's a medical condition of a specific organ.
And this shift has these profound therapeutic implications.
Oh, it's huge. It immediately decreases the shame and the guilt. It fosters forgiveness and compassion from the patient's family members and their social network.
And crucially, it elevates hope.
It elevates hope. When people feel validated that their persistent struggles are physical, the result of a damaged organ, not a moral failing or a lack of willpower, they become so much more motivated to seek help and comply with the necessary changes.
Even the difficult lifestyle changes required to fix the biological issues,
Especially those. They move from a state of victimhood to one of active empowerment.
which leads us directly to the mechanism that makes this reframe possible. Functional imaging, specifically SPECT scans, acting as a kind of GPS for the brain.
This is the truly critical disruptive technology that sets Dr. Amen's work apart. If you have that crushing chest pain, doctors image your heart. If you have chronic depression and anxiety, traditional psychiatry does, well, nothing of the sort.
Right, and SPECT, or single photon emission computed tomography, that's different from a structural scan like an MRI, right?
It is. So what's the technical difference that makes SPECT so useful here? An MRI or a CT scan shows you the brain structure. Does it have a tumor? Has there been a stroke? SPECT shows the brain's function.
Okay.
It measures regional cerebral blood flow and activity patterns, so it essentially creates a functional map of the brain. It's like seeing the wiring diagram, and it highlights areas that are overactive, underactive, or have low blood flow.
It makes the invisible physical illness visible.
Perfectly said.
Let's revisit the case of Dave, because that anecdote really crystallizes the entire problem and the solution.
Right. Dave and his wife, Bonnie, they had been in intense marital therapy for years, struggling with conflict, aggression, just constant unhappiness.
They spent over $25,000 and got nowhere.
Nowhere. Their therapist eventually gave up, recommended they get a divorce, and labeled their efforts an F in marital therapy.
Ouch. But the therapist, having run out of all the psychological options, suggested one last sort of Hail Mary pass, a brain scan.
And Dave's SPECT scan was, frankly, terrifying. It showed his brain looking shriveled and full of holes.
Like Swiss cheese.
Exactly. It resembled the diffuse damage patterns you typically see in chronic drug or alcohol abuse, even though Dave denied any substance use. The physical damage was just undeniable.
Which prompted the Amen Clinic's team to dig deeper into his biology and his environment.
And what was the actual physical cause of his violent mood swings and these relationship failures?
It wasn't psychological at all.
Not in the slightest. Dave was a glazer. His job involved heavy daily exposure to solvent toxicity. The solvents had chemically and physically damaged his brain tissue, leading to this diffuse, catastrophic damage and inflammation.
So the problem was entirely biological. It was caused by environmental toxins. So for years, they were trying to use talk therapy, emotional regulation techniques, anger management,
All these psychological tools.
to fix a physical organ that was literally being poisoned by chemicals. It was impossible.
Precisely. No amount of psychological intervention could ever repair chemically induced brain damage. And the case just illustrates the core of systemic failure. If you never look at the brain, you are guaranteed to miss the underlying cause.
And if you miss a toxic exposure or a severe infection or a head trauma, the patient is left treating a psychological symptom that is actually a biological result.
And they get labeled treatment resistant.
Okay, but here's the critical friction point. I'm sure the listener must be thinking this. If SPECS is this effective, why is the APA, the institutional power, dismissing it as only for research and not for routine care? Is it just the cost? Or is there some kind of institutional bias against seeing the brain as a measurable organ?
That question cuts right to the heart of the systems mapping, and we'll delve deeper into the incentives in a bit. But the simple answer is that the system is not financially or institutionally structured for objective testing.
It's not built for it.
Not at all. SPECT FDEGs are costly, and they're often not covered by insurance because the APA has not mandated them as standard of care.
Which creates a really troubling outcome.
It does. It means this demonstrably effective, life-changing diagnostic tool is often only accessible to those with significant financial means, which completely contradicts the goal of ending mental illness for everyone.
The institutional resistance is protecting an outdated, generalized model over personalized, effective care.
That's it in a nutshell.
So, moving away from purely biological solutions, Dr. Amen insists that true healing requires a holistic, whole-person approach. He frames this through what he calls the 4 circles.
Right, the 4 circles. They acknowledge that human well-being is, it's more than just brain chemistry. True, comprehensive healing requires addressing the entire life context across 4 interconnected areas: biological, psychological, social, and spiritual.
Okay, let's start with the biological circle. This is where we optimize the physical body and brain function, addressing the cells, the chemistry, blood flow, structure.
Correct. This is the domain of spec, diet changes, exercise, and targeted nutritional or medical interventions. It's the hardware component of the system.
Then second is the psychological circle.
This addresses the mental software. It involves cognitive work, specifically identifying and eliminating what he calls ANT's, automatic negative thoughts.
ANTs.
Right, that destructive, self-critical, and often untrue inner dialogue that just fuels anxiety and depression. It also deals with self-concept, body image, and processing past emotional trauma.
And the social circle.
This is all about your environment and your support systems. It means improving the quality of your relationships, managing chronic interpersonal stress, and making sure you have healthy social interaction. We know that loneliness and isolation are powerful risk factors for cognitive and emotional decline.
So social connection is mandatory for brain health.
Absolutely mandatory.
And finally, the spiritual circle. This one is so often ignored by conventional medicine.
It's the most overlooked, but, arguably one of the most powerful. The spiritual circle is about cultivating purpose, finding meaning in your life, and establishing a connection to something larger than yourself.
Whether that's a higher power, the planet, or even just a connection to past and future generations.
Exactly. And the absence of this dimension isn't just a philosophical problem, it translates directly into biological decline.
Wait, okay. How does a lack of purpose physically damage the brain? Can we get a deeper look at that mechanism?
The research is really clear on this. When we lack a defined purpose and meaning, the brain tends to default to the state of chronic, low-grade stress and rumination.
This keeps the amygdala, the brain's fear center, on high alert all the time. This chronic stress results in higher, sustained levels of circulating cortisol. And cortisol is the stress hormone. Right. And that cortisol then drives systemic inflammation, it damages neuronal health, and it even promotes fat storage in the abdomen. So a deficit in the spiritual domain, a feeling of meaninglessness, has a direct and measurable biological consequence. It contributes to mental illness vulnerability.
That connection is just key. The idea that our existential state is physically expressed in our cortisol levels and our abdominal fat.
It connects the abstract to the biological in a way that conventional psychiatry simply misses by focusing only on symptoms.
So to successfully implement change across these 4 circles, the book provides a really concise, actionable blueprint for prevention and treatment. It's the 11 modifiable risk factors, called Bright Minds. And these are the elements that are most commonly found to be destroying the brain and, stealing the mind. This list is the clinical distillation of those 170,000 brain scans. If a patient is struggling, the intervention has to target these specific biological mechanisms.
They show how profoundly sensitive the physical brain is to both external and internal conditions.
Absolutely.
So let's dedicate some time to running through these 11 factors and their mechanisms, starting with B, blood flow.
Low cerebral blood flow is perhaps the single greatest risk factor Dr. Amen's work has identified. When blood flow is compromised, the brain simply cannot get the oxygen and nutrients it needs to function.
And you see this deficit consistently in the SPECT scans associated with depression, memory loss, aggression.
All the time. It's often a result of conditions like hypertension, smoking, severe TBI, or even obesity. The brain is basically starved into sickness.
Next up is R for retirement and aging.
And this isn't just about getting old. It's about cognitive atrophy through disengagement. The principle is fundamental. When you stop learning, your brain starts dying.
Use it or lose it.
Literally. Research shows that maintaining and intellectually stimulating life learning new skills, having a purpose, staying socially engaged, is profoundly protective. Loneliness and the lack of purpose, often associated with mandatory retirement, can dramatically accelerate cognitive and emotional decline.
Then there's I for inflammation. This is just a massive driver of modern illness across the board.
Inflammation is the fire within that causes so many psychiatric and cognitive symptoms. It can be triggered by a poor diet, processed foods, high sugar chronic stress, poor gut health, or hidden infections.
And critically, inflammation has been linked directly to decreased functional connectivity in the brain's reward circuitry in depressed patients.
And it's a known risk factor associated with suicide. If you want to heal the mind, you absolutely must quench the systemic inflammation.
Okay, G for genetics. This is the factor that people most often believe they can't fight.
And that's the crucial distinction the book makes. Genes increase your vulnerability, but they are not your destiny.
Genetics load the gun, but lifestyle pulls the trigger.
That's the perfect analogy. The source material emphasizes epigenetics, the ability of our choices in our environment to turn genes on or off. For instance, knowing you have a genetic risk factor like APOE4 for Alzheimer's doesn't doom you.
It empowers you.
It empowers you to implement specific targeted interventions like avoiding contact sports, increasing your omega-3s, and optimizing your sleep to mitigate that risk.
Moving to H for head trauma.
This is the silent epidemic, and shockingly, it is routinely missed in standard psychiatric evaluations. Functional imaging clearly shows that damage from head trauma, even mild concussions or cumulative subconcussive hits, can underlie many chronic issues years later.
Issues like mood disorders, aggression, PTSD, even addiction vulnerability.
Right. Dr. Amen's extensive work with NFL players vividly demonstrated that high-impact sports cause visible, measurable brain damage, even in college players, which persists if it's not treated.
Then T for toxins, like in the Glaser solvent example.
Toxins are one of the most ignored causes of brain health issues by traditional psychiatry. The brain is metabolically hyperactive, which makes it highly vulnerable.
And the source material details how mycotoxins, which come from mold exposure, can trigger severe neuroinflammation.
That manifests as crippling anxiety, severe depression, or attention deficits. And it's all missed because the psychiatrist is looking for a serotonin imbalance, not a biological invader.
Other toxins include things like heavy metals, drug and alcohol abuse, environmental pollutants,
Yeah.
even anesthesia.
Even anesthesia, which can impact vulnerable brains, yes.
Next, M for mind storms.
This refers to abnormal electrical activity in the brain. It's often subtle seizure activity that doesn't manifest as a full tonic-clonic seizure.
But instead, it drives things like mood swings, aggression, irritability, or panic.
And it's often misdiagnosed as bipolar disorder or just severe anxiety. The classic example of the financier Jack Dreyfus, who sensed this intense electricity in his body during a severe depression, it just underscores the need to look for these electrical imbalances.
And they're often highly treatable with anticonvulsants or even nutritional supplements like GABA,
Exact.
followed by I for immunity and infections.
This is a fast-growing area of research showing that many complex cognitive and psychiatric symptoms are linked to infections that cross the blood-brain barrier.
Things like Lyme disease, toxoplasmosis, strep.
All of these can contribute to complex, severe disorders like schizophrenia or OCD. The maps showing the highest incidence of schizophrenia and the greatest risk for Lyme disease in the U.S. overlap significantly.
That suggests a profound and, frankly, terrifying connection that conventional psychiatry just dismisses as psychiatric.
When it's fundamentally immunological.
Then N for neurohormone issues.
Hormones are often called the miracle grow for your mind. Imbalances in thyroid function, chronic high cortisol from stress, or low sex hormones
Estrogen, progesterone, testosterone.
are frequent yet missed causes of classic psychiatric symptoms. For example, hypothyroidism can present entirely as psychosis or treatment-resistant depression. You can't fix the mind if the essential chemical messengers stabilizing the brain are wildly imbalanced.
The 10th factor is D, diabetes.
This combination of high blood sugar and obesity is one of the most widespread biological attacks on the human population today. Only about 12% of Americans are currently metabolically healthy.
Just 12%.
It's a catastrophe. And diabetes quite literally destroys brain tissue by promoting massive inflammation and critically causing insulin resistance.
And how does insulin resistance affect the brain specifically?
The brain relies almost exclusively on glucose for fuel. Insulin resistance prevents glucose from efficiently entering the brain cells. So it's essentially starving key regions of the brain that control mood, memory, and impulse control.
And that starvation leads directly to depression, anxiety, severe cognitive decline.
Making it one of the major drivers of mental health issues and dementia globally.
They're finally the last letter, S for sleep.
Sleep is completely non-negotiable. It is when the brain cleanses itself. During deep sleep, the glymphatic system washes the brain, clearing out amyloid plaques and other toxins and waste products that accumulated during the day.
So inadequate sleep or chronic sleep deprivation is directly linked to massive increases in anxiety, depression, and long-term cognitive problems.
Addressing sleep disorders is a mandatory first step in the Bright Minds protocol.
It has to be. Okay, so we've outlined the technical solution. Use objective measures, adopt a comprehensive biological first approach focused on these bright minds factors. But to understand why 84% of complex patients fail standard care, we have to map the system's incentives. What keeps this outdated symptomatic model in place? This is the critical systems analysis portion of our deep dive. Why would a medical specialty actively resist demonstrably more effective outcomes? Let's map the dominant system's incentives, what we sometimes call the evil ruler.
The financial incentives are, well, they're paramount, and they are deeply entrenched. Pharmaceutical companies are the major funders of psychiatric meetings, of continuing medical education, and of key academic journals.
Their entire business model thrives on generalized, drug-based, lifelong solutions.
Absolutely. Medications, especially SSRIs, are often very hard to stop once you start them. They lead to issues like emotional blunting or discontinuation syndrome, which ensures a continuous demand. This financially steers the entire academic and clinical field away from root cause solutions.
Solutions that involve things like diet, detoxification, and difficult lifestyle changes.
Right. Things that don't have a profit margin attached.
And the sources highlight the astonishing fact that primary care physicians, PCPs, they're the ones prescribing 85% of all psychiatric medications.
This is a massive systems failure. It's driven by efficiency demands and a lack of specialization. PCPs operate under immense time pressure. They have, what, a 10 to 15-minute window per patient?
If they're lucky.
Right. And when a patient presents with anxiety or depression, it is simply more efficient to match a symptom cluster to a readily available pill than it is to order comprehensive biological or functional tests.
And the data shows that, shockingly, 72% of these psychiatric prescriptions from PCPs are made with no diagnosis recorded in the patient's chart.
It's an industrial process. It's not comprehensive medicine.
And the institutional authority that supports this entire generalized symptomatic approach is the American Psychiatric Association, the APA, which holds the proprietary interest in the DSM.
The ATA is the ultimate gatekeeper. They promote the generalized symptomatic approach, and at the same time, they use their institutional power to dismiss objective biological tools like SPECT imaging as experimental or only for research.
So by protecting the DSM, which serves as their textbook, their billing code guide, and their source of authority,
they keep psychiatrists as the only medical specialists who virtually never look at the organ they treat.
It's astonishing that Thomas Insel, the former director of the NAMH, famously called the DSM 100% reliable but 0% valid, yet the institution resists overhauling it. Why is this institutional inertia so powerful?
It's not just inertia, it's an entire entrenched ecosystem. Academic careers, medical school curricula, insurance reimbursement systems, legal liability, they're all built around the categorical diagnoses of the DSM.
So to adopt the Amen model would mean dismantling decades of institutional power.
Retraining the entire psychiatric workforce and forcing insurance companies to pay for comprehensive testing. That level of systemic disruption is resisted, and resisted vigorously, by those whose livelihoods and authority are tied to the old model.
And this resistance, it feeds that negative narrative we talked about earlier, that subtle placement of blame on the patient.
Precisely. If I can't find a tumor or an infection or a toxin with the tools I'm allowed to use, then the failure narrative shifts to the patient. You lack willpower, you are treatment resistant, it is an inherent psychological deficit.
This external blame fuels shame. It hinders recovery, and it forces the patient into a cycle of just symptomatic relief rather than true root cause healing.
It's a trap.
Let's talk about the feedback loops that reinforce this failure, starting with what you could call the inadequate treatment loop.
Okay. The loop starts when the patient is diagnosed based on those superficial symptoms defined by the DSM. Their underlying biological causes, be it undiagnosed head trauma, a fungal infection, a severe hormone deficiency, are completely missed because objective testing is standard.
So the symptom-based medication often fails, or it causes severe side effects like emotional blunting or sexual dysfunction.
Right. And then the system labels the patient treatment resistant.
And since the biological problem still exists, the patient just spirals into increased despair and shame, and the provider's confidence decreases.
And that's why Amen Clinic's patients average 3.3 failed providers and 5 failed medications before they find success. The system is designed to fail these complex patients who have biological root causes.
At the same time, you have this powerful food and culture loop, which the book describes as a mechanism of biological warfare against the population.
That's a strong term, but when you look at the mechanics, it fits.
This loop describes how corporate profit motives drive the promotion of low-quality, tasty food,
Yeah.
which is often high glycemic and processed.
Yes. The standard American diet, or SAD, is a systemic biological weapon. It's high glycemic, it's processed, it's often laden with pesticides, and this diet is specifically engineered for addictive palatability.
And it promotes the very bright mind's risk factors we just discussed.
Yeah.
Inflammation, eye, and diabetes. This constant influx of inflammatory, sugar-laden food physically damages the brain.
Right. And the damaged brain function, starved, inflamed, and riddled with low blood flow, is what leads to the mental health symptoms, the anxiety, the depression, the impulse control issues.
Which in turn reinforces reliance on the symptomatic treatment system, the quick pill, instead of the difficult nutritional and lifestyle changes that would actually heal the organ.
It's a closed, self-reinforcing system. Profit leads to illness, which leads to a demand for pharmaceutical treatment, which conveniently avoids the need for true systemic change in our diet and lifestyle.
Dr. Amen's work, therefore, it really represents a classic moment of scientific paradigm clash, a kind of Kuhnian revolution in psychiatry.
Absolutely. The standard paradigm, the DSM, is demonstrably failing. That's stage 1 failure, evidenced by the epidemic numbers of suicide and addiction.
This chaos leads to a proliferation of competing, often contradictory treatments.
That's stage 2, over 250 types of psychotherapy, dozens of medications, all competing. This instability necessitates the emergence of a new paradigm, stage 3, which is the objective neuroscience-based model advocated here.
And the only thing sustaining the old model is institutional power and inertia.
That's all that's left holding it up.
Shifting gears, let's look at how these insights connect to the systems shaping our modern world, the present-day implications. The book argues that many of our modern institutions are actively, though often unintentionally, engaging in a kind of biological warfare by incentivizing these bright minds' risk factors.
Let's take diabetes and institutional culture. The book refers to high-sugar diets as functional weapons of mass destruction, and you see them everywhere we gather.
Think about schools and workplaces.
Exactly. What is the standard fare? Vending machines full of processed snacks, high-sugar cereals, soda, candy bowls in break rooms, and low-quality subsidized food in cafeterias.
The system provides these immediate, cheap pleasure rewards, but it accelerates brain and mind illnesses like diabetes and inflammation.
The institutional incentive, whether it's convenience, profit, or government subsidies for poor quality ingredients, it prioritizes everything over metabolic health. It ensures a constant supply of damaged, inflamed brains that require symptomatic intervention.
And the cultural normalization of head trauma is another terrifying modern implication.
Despite the overwhelming evidence you can see in SPECT scans, the culture maintains this powerful, damaging tradition around high-impact sports.
The normalization of tackle football, even at young ages, just continues.
And Dr. Amen's research shows measurable functional damage in high school and college players. This highlights a system that prioritizes tradition, entertainment, and profitability over neurological preservation, especially in communities where these sports are seen as a sole avenue for success.
We also see this pervasive psychological and social warfare accelerating in the digital age, hitting the social and spiritual circles hard.
The digital age has absolutely weaponized the social sphere. We're subject to constant social warfare that's perpetuated by media and political discourse.
They use negative news cycles and this us versus them rhetoric, political, racial, ideological, to maximize engagement.
And this strategy drives chronic stress and social separation. The research cited shows that just 14 minutes of negative news can demonstrably increase anxious and sad moods. This chronic, low-grade fear state damages the brain through sustained cortisol exposure.
And then social media acts as this significant psychological weapon, perpetuating shame.
It creates a system of endless curated comparison. You are constantly comparing your messy real life against the highly filtered, perfected highlights reel of others.
Which perpetuates a state of feeling inadequate. It generates shame, dissatisfaction, and psychological damage.
And when you couple that with the cultural drift toward meaninglessness, that deficit in the spiritual circle, you have a perfect storm for systemic vulnerability.
But the book provides an antidote, a detailed, benevolent ruler's blueprint for institutional countermeasures, shifting the focus from individual blame to institutional support.
The blueprint is about redirecting resources away from symptom treatment and toward widespread public education and prevention.
For instance, creating national high-impact campaigns like Brain Thrive by 25.
Right, which is designed to teach teams how to love and care for their brains, focusing on the bright minds factors. And independent research found that this program, which is taught in 7 countries, successfully reduced depression and substance abuse in teenagers.
And the success of the Daniel Plan. That demonstrates the power of leveraging the spiritual circle for biological gain at a community level.
It's a remarkable example of systemic change outside of conventional medicine. It was implemented in thousands of churches, mosques, and synagogues, and it resulted in massive community-wide weight loss, improved mood, increased energy, and focus for participants.
All by focusing on the 4 circles and eliminating bright minds risk factors like diabetes through communal effort and a shared purpose.
It works.
Ultimately, the fundamental shift has to happen in the healthcare system itself. The system needs to be incentivized to look for the cause.
Absolutely. The blueprint calls for mandatory annual testing of important health numbers. We shouldn't be guessing at underlying issues.
This includes testing things like thyroid levels, cortisol, omega-3 index, vitamin D, blood sugar.
And genetic testing to identify vulnerabilities. If the system focused on prevention and early intervention guided by objective biological measures, it could move healthcare dollars away from the 75% that's currently spent on treating chronic illness.
And toward educating the public about the modifiable bright minds risk factors, especially in food and lifestyle choices.
A proactive system instead of a reactive one.
As we step back, let's connect this analysis back to the broader systems themes we explore here on crisis and perception. The central insight here is the clash between systems versus individual blame.
This is the crux of the whole problem. The current system's reliance on symptomatic diagnosis means that perceived personal failures, a child's uncontrollable temper, a student's inability to focus, an adult's paralyzing depression are often just the predictable outcomes of a damaged, sick organ.
An organ that's been damaged by systemic factors like undiagnosed head trauma, environmental toxins, or severe hidden infections.
Right. And when the system fails to identify that a problem is medical, that the brain is physically sick, the default position becomes moral judgment and blame.
The intense social stigma we see is a direct byproduct of this system failure.
It has to be. If the cause is a toxin-damaged brain, that invites compassion and urgent medical intervention. But if the system labels it intermittent explosive disorder, or IED, based on symptoms alone, the societal response is punitive measures, shame, and a sense of moral failing. The label dictates the entire response.
And secondly, we clearly see power hidden inside neutral processes. The DSM is legally and institutionally presented as this neutral tool, just a dictionary for human suffering.
But it is anything but neutral. The DSM is a mechanism of power. It dictates what counts as real illness, legally, professionally, and for insurance reimbursement.
And by excluding objective biological reality, the neuroscience and functional data from SPECT, it reinforces a generalized symptomatic approach.
Which conveniently supports a financially lucrative pharmaceutical path. The institutional power resists change because the established symptom-based model is profitable and entrenched, regardless of the patient outcome data.
And finally, the shift in moral narratives in institutions. The book really attempts to replace the deep-seated moral accusation inherent in the term mental illness, the idea of being mad or unstable.
It replaces it with a scientific, compassionate understanding that behavioral problems stem from physical malfunction. This institutional shift from morality and blame to objective, measurable medicine is essential for widespread, effective healing and prevention.
It moves the entire conversation from what is wrong with you to what is wrong with your brain and how can we heal it.
So in summary, what the end of mental illness helps us see differently is that mental illness is not some mysterious defect of character or mind.
No, it's a preventable or reversible brain health issue. It's profoundly influenced by biology, environment, relationships, and purpose, the totality of the 4 circles.
The key takeaway is the power of objective biological assessment and targeted intervention focusing on those bright minds factors. This offers a radically more hopeful and, demonstrably more effective path than the current model. A model that is currently failing to manage 25% of the entire global health disability burden.
And this perspective matters because it fundamentally shifts the conversation. It moves from passive victimhood or inherited shame to active empowerment. Your genes and your past experiences might be powerful vulnerabilities, but they are absolutely not your destiny.
You have a blueprint, You can improve your brain function, and when you improve the physical organ, the mind will inevitably follow.
The analysis, however, it raises some pretty critical questions about the future. If Dr. Amen's clinics have published data showing these high success rates with complex, treatment-resistant patients using this brain-centered paradigm,
How long can the institutional resistance from the APA, major medical schools, and powerful insurance payers continue to prioritize a non-biological symptom-based system over demonstrably effective care?
what will it take? A government mandate? A complete financial collapse of the current system? What will it take to finally overcome that profound, entrenched systemic inertia?
It's the multi-billion-dollar question, isn't it?
I think we'll leave our listeners with this provocative thought. The most complex organ in your body controls everything you are and everything you do. Your choices, your relationships, your happiness. If we have the power to protect and optimize the brain through conscious choices and objective measurement, what responsibility do we have not just for our own brain love, but for building systems in our families, workplaces, schools, and communities that foster brain health for the generations to come?
Indeed. The fundamental question must always be, is this system, is this choice good for the brain, or is it bad for the brain?
We want to thank Daniel G. Amen, MD, for The End of Mental Illness.
We encourage you to read the book yourself, support the author if you found the ideas valuable, or check your local library for free access.
For a shorter visual overview of this topic, see the mini explainer linked in the description.
If you enjoy this kind of systems-level analysis, please like, subscribe, and comment with books or topics you'd like us to explore next.